Hey RSN networkers, and welcome to our very first session of our online workshop series. Today we've got a very interesting speaker, Dr. Ndiviwe Mphothulo, who's going to be speaking about the impact of COVID-19 on rural health. Dr. Mphothulo holds the following qualifications: MBCHB, Diploma in HIV Management, Master of Public Health, and Master of Business Leadership. He has been a medical doctor for 18 years, 17 of which have been in rural areas. His career started with internship at Groote and Red Cross hospitals, followed by community service at Taung District Hospital. Some of his accolades include the MEC Award for Best Performing Medical Doctor in a Northwest Province in 2013, Medical Community Builder of the Year in 2014, South African Rural Doctor of the Year in 2015, Spirit of Medicine Award from the South African Medical Association in 2017, and Annual Innovation Award from the Public Health Association of South Africa in 2019. So we've definitely got a force in our hands. He's currently a board member and the deputy president of the Southern African HIV Clinicians, treasurer of the Rural Doctors Association of South Africa, and is the member of the Ministerial Advisory Committee on COVID-19. Enjoy.
I would like to take this opportunity to thank the UCT's Rural Support. I would like to take this opportunity to thank the UCT's Rural Support Network for giving me this opportunity to talk about the impact of COVID-19 on rural health system in South Africa. South Africa recorded its first COVID case on the 5th of March 2020, and on the 15th of March 2020, President Cyril Ramaphosa declared a state of disaster. A national lockdown was declared on the 23rd of March 2020, and from the 1st of May, there has been a gradual and phased easing of the lockdown. As of 11th May 2020, on the evening, South Africa had a total of 10,652 COVID cases. It had 206 deaths and had 4,357 recovered cases, and had just about 356,000 tests conducted so far. So, for the purpose of this discussion, provinces with majority rural settlements and which have rural populations of more than 30% in each province will be classified as rural. So these provinces are the Eastern Cape, the Free State Province, KwaZulu-Natal, Limpopo, Mpumalanga, and Northwest Province. Now, there's different definitions in fact, there's been different numbers that have been given on the population of South Africa, on the rural population of South Africa to be exact. So, for the sake of this discussion, we'll say the rural population in South Africa is between 35 and 40% of the total population of the country. So as of 11th of May 2020, as I've said, we have a total of 10,652 COVID-19 cases in the country. Now, out of that, rural provinces have 3,060 cases of COVID-19. So that means the rural provinces contribute 28.7% of COVID cases in the country, and they've got 78 deaths, which is about 37.8% of the deaths from COVID-19. Now, from these statistics, we can see that the population of cases, the proportion of cases, is about 28.7% in rural provinces. So this proportion is less than the estimated rural population, which we said is between 35 and 40% in the country. And the deaths at 37.8% are also in between the 35 and 40% estimated proportion of rural people in the country. Now, it is important to know that even in rural provinces, it is urban areas which has more COVID-19 cases. For example, in KwaZulu-Natal, 64% of the cases are from eThekwini Metro only. And in the Eastern Cape, 62% of the cases are from Nelson Mandela Bay and the Buffalo City Metropolitan. These statistics therefore tell us that COVID-19 is mostly urban-based. Now, although it seems like COVID-19 is urban-based, rural areas are not immune to COVID-19. Rural areas have an advantage of having scattered settlements and low density of population. This makes social distancing easy to attain in rural areas, and chances of human-to-human transmission of virus are less in rural areas. So, although low density and distance between households offers some protection against the spread of infectious diseases in rural areas have got their own unique vulnerabilities. Now, the population in rural areas have the following vulnerabilities. One, in rural areas we've got a high number of chronic cases of people with chronic diseases like hypertension, diabetes, and cardiac diseases. Again, in rural areas, we've got high levels of poverty, we've got high levels of malnutrition, we've got poor access to healthcare facilities, you've got low levels of education, you've got poor access to clean and running water, you've got poor access to sanitation. Also, you've got a proportionally higher number of elderly population compared to your urban population. Now, the healthcare system in rural areas also face multiple challenges, which include the shortage of staff. We know that rural areas have 12% of doctors in the country, and they've got 19% of the nurses in the country, but they serve a population of between 35 and 40%. In rural areas, we've got poor functioning health system, you've got poor resource allocation to rural healthcare, you've got no access to specialists, you've got aging infrastructure, and you've got poor access to specialized laboratory services. And then again, in rural areas, health workers are overworked. They complain of lack of personal protective equipment, the PPEs. They complain that they have no skills and they don't have training compared to their colleagues in the urban areas. They're anxious because of lack of high care facilities in their hospitals. Now, one would ask, what would have been RUDASA's response to this COVID-19 crisis? Now, RUDASA has had different interventions. I think I'll count a few. One, RUDASA is a member in the Ministerial Advisory Committee on COVID-19. Various RUDASA members are in district COVID-19 committees and task teams across the country. Also, RUDASA has developed resources on COVID-19 for rural areas. Those will be interventions like developing protocol and infection control programs, developing an ideal rural response plan, working through its networks to share best practices of what works and what doesn't work in the rural setting. Now, moving forward, the government should ensure that rural hospitals adopt to the new normal of COVID-19 era. So in this new normal of COVID-19 era, we need to make sure that we attract health workers to rural areas. We develop education and training programs to retain health workers and doctors, develop CPD plans, and ensure that there's career pathing for rural health workers and doctors. However, in the long run, the long-term solution in the rural areas is improving the living conditions of the people in the rural areas, improving the economy in the rural areas, improving the infrastructure in the rural areas and ensure that rural areas are habitable for the population and the doctors. Thank you very much for the opportunity.